Senator Thorpe. Senator Roberts.
Thank you, Chair, and thank you for being here today. 6 months or so ago, in response to one of my constituents on Mornington Island, one of my office visited the island and he was shocked with the outright squalid conditions that the islanders are forced to endure, absolutely through no fault of their own. We're planning for me to visit with all the Aboriginals in the coming dry season right across the whole of the Cape, including Mornington Island. It's recently been the subject of interest in the Queensland media due to the poverty and poor health of the islanders living there. And I understand the Queensland Premier and the Queensland Health Minister have both said they will visit the island to see the conditions for themselves, so they're obviously aware that it's shocking. So my first question is, with the dwindling population of less than 1,200 residents on Mornington Island, why is the medical centre only manned by nurses with no resident doctor to look after the needs of the residents when 50% of the population are reportedly having chronic diseases?
It's a very broad question.
It is, yeah.
Yeah, but I think, so in terms of provision of good primary health care for that, then we don't specifically mandate the requirements for each particular health centre that has to have, X, Y and Z. It tends to be the health clinics will tend to work out what they'll need for that. Most will have arrangements for where there is a nurse-led, post which will deal with a lot of emergencies, and then that's usually where they'll connect up. And that is for a lot of the day-to-day provision of for basic primary health care. For more chronic needs, then most of the clinics have arrangements with either they'll have GPs visiting from time to time, or they'll connect people up on in through other services in mainland to basically get that provision of GP service. So it depends. It varies a little bit from service to service how that'll be done. Mornington Island, I think, would need to go and check. So I'm not actually sure whether that's a community controlled clinic. It may actually be a Queensland government clinic as well, possibly for that. So we would need to go and find a little bit more detail specifically around that. But it does vary from community to community about how the clinics provide healthcare and how they will access into their, for the GP services. But nurse-led posts are not uncommon in remote communities because they are a way of of delivering good frontline healthcare and then connecting up with with GP care when needed.
Yeah, I accept and understand that a lot of the nurses are wonderful.
Absolutely.
But why are so many residents of the island needing dialysis off-island, and how many are treated this way? Now, you probably have to give me that on notice.
We would need to, in terms of specific numbers about how many would be needed, how the dialysis cohort on Mornington Island, we'd absolutely need to go and check with that. And that, dialysis is generally a state and territory provision through, hospital and outreach services if they structure that. There are, in various places in remote, dialysis chairs, and we have some visiting services around that to return people in there. But obviously a lot of the people with dialysis can have other complex issues, so sort of being able to provide the dialysis in a setting that has that wider, medical facilities which is why quite often dialysis occurs in hospital settings and those sort of places. Yeah. Although obviously there is a general movement in some areas to try and get dialysis back into closer to community, and that's why we have things like Purple House and providers, particularly in the territory and some of the remote areas, who will then provide dialysis closer to home.
Sorry, Senator, we'll probably have to take a lot of the detailed questions around Mornington Island specifically on notice.
Yes,
but certainly Mornington Island has a hospital and a healthcare centre run out of the hospital that's provided by Queensland Government. Its staffing and its adequacy we'd need to talk to Queensland about as well.
Okay. Thank you. So taking on from Mr Matthews' point, it is more complex than just simple dialysis. Why is type 2 diabetes, for example, so common in the residents, even including teenagers, and how many are treated for this? So you'd have to do that on notice.
We'd need to take that on notice.
So would the chronic shortages of affordable fruit and vegetables and widespread malnutrition have something to do with it?
I couldn't comment without knowing the details, Senator, but sadly, chronic conditions and the incidence of chronic disease is, high in Aboriginal and Torres Strait Islander communities,
and even malnutrition,
particularly remote communities.
Yeah. For such a small population, why is the death rate of residents so high? And how many deaths occurred last year? And why is the suicide rate in particular so high, even extending to child suicides? And how many in the last year, children and adults, suicided?
again, we would need to take
No,
the
that's
specifics
fine.
of data, but I mean, they're obviously very multifaceted issues as well that are not, you know, there's a range of factors across all of those that would lead to them that are not specific to a, you know, a health intervention from a health clinic or something like that. They, you know, there are any number of reasons that would lead to those, you know, outcomes. It's very complex.
Yeah, I accept that it's complex and we need to dig into the issue, and that's what my questions are trying to do. Could the lack of quality accommodation be a cause when currently up to 11 people reportedly pack into small 2-bedroom houses, many people to the cramped rooms, or even are forced to sleep rough with no roof or protection from the tropical weather? So it's not just a health issue, it's not just a suicide issue, it's also a housing issue. So is the confusion about the native title status of the island affecting the health of the residents?
I don't think we could speculate on that. I think,
Okay.
Senator, that would, yeah, no, I don't think we could speculate on that at all.
Because we raised questions about native title yesterday, and it's actually preventing, well, we won't go into that here. Is home brew a cause of the widespread kidney failure in the community?
We couldn't comment without further information from Mornington Island, Senator.
Well, perhaps I'll ask several questions together, and you jump in if you can answer any. And I'm not criticising you for being able to accept your trustworthiness.
That would be
service and
exactly.
the specific
Yeah, and a
circumstance.
lot of these questions we may not necessarily be able to answer. They would be questions for the community broadly, as opposed to perhaps what we will do what we can to answer them. But some of them we may not actually be appropriate for us to either answer or speak on behalf of community.
Perhaps you could let me know.
Answer.
Yeah, I accept that. Has the closure of the island canteen been an indirect cause of the overuse of poisonous home brew within the community? Would reopening of the canteen for managed and limited sales of low alcohol, mainstream alcohol, be better than driving people addicted to alcohol to drive dangerous home brew? Would it be beneficial for the government to subsidise the costs of fresh fruit and vegetables for the community? Could the federal government fund and audit the commenced but never completed market garden promised to the community by the government to assist the community to be self-sufficient in growing crops to feed themselves? Could the use of the once-a-week barge service be subsidised to lower the cost of bringing fresh fruit and vegetables, fresh milk and other healthy foodstuffs to the shops? There's one grocery store there for the residents. But this is a really interesting question, and again, I don't expect an answer other than on notice. Why is there no fishing industry in a region rich with marine resources? There were 3 large tinnies that my staffer saw abandoned on the dump because they needed simple welding repairs. Why is there no mechanical service on the island to keep machines, vehicles and boats going? And this is the reason why many repairable vehicles and white goods stand abandoned across the island and at the dump. Why was the cattle herd that existed for many years on the island destroyed?
Senator Roberts, I understand the validity of your questions, but I'm not sure if the Department of Health is the right agency to be asking them to.
I think we're looking at a multifaceted, multi-layered health issue, and we need to get to the core of it. Mm-hmm. These communities have been abandoned in many senses for a long time.
Environmental health. That's what you
living environment. Perhaps if I could, there's another one here, Chair. Could the creation of real jobs for the residents perhaps involve the hundreds of wild horses that roam freely on the island? Could it assist to alleviate the high mental health, depression problems of the community? Or the fishing industry or the tourism? And here's the really important question I'm leading to. Why are there many programs currently on the island to assist youth and the aged on the island missing? They're just not visible on the island. So I suggest that a real audit of services, not a paper audit, but a real audit be provided to the island, and that's desperately needed. Where's the federal money going?
So, Senator, we're going to have to take the majority of the health-related questions on notice and specifically drill down into the funding that goes to Mornington Island, what it's used for, how it responds to particular health issues. Obviously, there's a range of other portfolios and the state government that's involved in funding there as well, and questions around industry development and jobs. Obviously.
And the problem is a difficult one for you because it's not. I'm trying to paint the picture that it's not as simple. Give them a jab or give them something else. It's a really serious issue.
We understand, Senator.
As Senator McCarthy said.
Senator, if I could just I'll give you some information on the market garden issue on Mornington Island. There is an existing market garden initiative on Mornington Island which is delivered as an activity under the CDP. And we are aware that, and we've been talking with the Mornington Shire Council, and they're interested in establishing a larger commercial market garden for the community. And my understanding is they're trying to negotiate now with traditional owners to gain the use of a parcel of land which is subject to native title to develop a larger scale commercial garden. So there is some movement in terms of market gardens there.
Good.
Just to clarify, as Mr. Richard said, I think we're quite happy to take a lot of the health questions. I think we may need to, as I'm sure the Secretariat, will need to work, and a lot of those questions really get to the broader social determinants, which are well beyond the health department. So we might need to work out where those are best addressed, because otherwise, we will not be able to answer a lot of the questions broadly about, particularly employment, housing, fishing industries.
Perhaps some of your questions, Senator, directed more generally rather than to the health department with respect to.
As Senator McCarthy said,
no, I'm not disagreeing with you, but some of the questions that you've asked, while having that broader, as Senator McCarthy said, environmental health perspective, but some of them clearly go to some of the other indigenous programs rather than the more health specific ones that operate in that community, and it might be that you can get more definitive answers to your questions by directing them in a different way.
Thank you for that advice. I'll take heed of it. I'm also concerned, though, that the people on the ground in these communities are not getting the money that's being poured their way, and people in the Aboriginal industry seem to be taking it along the way. And that goes to every federal government. I'm not saying it applies to every federal government initiative, but it goes to a lot of the federal government pathways for money. And that the people who really need it are not getting it.
Well, I think that actually goes to the point that I was making with respect to some of the broader programs that are operated and how they might be perhaps coordinated. Sort of gets to the root of what you're talking about. And
Senator Colbeck, perhaps I could ask you, the paternalistic and patronising approach, I'm not accusing you of this, of supposedly helping these communities over many, many years, is probably, I'm sure is hurting them, having visited a lot of the communities. And maybe that's something that could change in direction, because we can't keep going like this.
Senator, I think from a government perspective, what we would like to see is programs that are effective on the ground. A lot of the conversation, I think, today has been quite constructive in actually seeing and achieve that, getting results. So, again, my point about where your questions get directed, then going to interrogating the way that some of those programs work, so that and the term continuous improvement's been used a few times here today, and certainly my aspiration, and clearly yours and others sitting around the table, would be that we continue to improve the circumstances of people living in communities and their how they are engaged as a part of that process is, as you quite rightly point out, very important, rather than necessarily being imposed.
Can I just make one final comment in response?
Is it a comment or is it a question, Senator Roberts?
It is a comment to Senator Colbeck.
This is more the forum for asking questions of ministers than making comments to them.
Well, I frame it as a question. Senator Colbeck, I'm familiar with continuous improvement versus step change, and what I'm suggesting here is continuous improvement of the same old process is not going to work. We need a step change. Wouldn't you agree?
Senator, I was not looking... look, I won't disagree with you. I think clearly the circumstances and conditions need to be improved. It is quite a complex area, as I think has been demonstrated by your questions and by your statements, and that would align with, I think, all our aspirations.
Thank you, Chair.
Thank you very much, Senator Roberts. We are due to adjourn at 3. Senator Dodson, how much longer do you have to go?
Oh, look, I'm not going to punish people any further today.
You're
so
happy to put
I
your
defer
questions on
Wait
notice?
till health.
I'll wait till health comes up tomorrow or next week. And,
we had all the answers on the Kimberley, Senator Dodson, ready for you.
Don't worry, they'll come. They'll come.
Probably just to finish up, probably with just one thing, just to further to Senator Roberts, just around one thing that we do in the health space. I think perhaps not. I don't think is quite as relevant necessarily for Mornington Island as such, but Obviously, through the work we do to support comprehensive primary health care driven by Aboriginal and Torres Strait Islander community-controlled organisations, that is effectively the reason why that has, not grown, obviously grown from Aboriginal and Torres Strait Islander people wanting to kind of that sense of self-determination and growing their health services. For that is about putting them in charge of health and that, and getting improved outcomes through that. And so we are at the moment going through a process to strengthen and work, very collaboratively with the sector to strengthen it over the time. We have put funding into that sector to strengthen it recently. We injected about $90 million over 3 years into that of recent times. We put a further $36 million into that recently to expand services. There's a new clinic that we've set up in Pantakuna in Newman, in WA. So we have been trying to go, and we will continue to keep working away with that sector in line with the new Closing the Gap agreement because of that exact point you're talking about, in terms of strengthening community and strengthening, backing the local communities in to provide services for local communities.
And to acknowledge that, I've seen communities in the Territory and in Queensland who are proudly talking about some of the measures they're taking in regard to preventative healthcare through food and nutrition. So I acknowledge that.
So we are working very closely with the National Aboriginal Community Controlled Health Organisation and their affiliates on those matters.
Oh, no.
Thank you.